Well, good afternoon, everyone. Pleased to advise that the ACT has become the first Australian jurisdiction to reach 80% full vaccination for its 12+ population. We've now administered 363,000 first doses to Canberrans 12 years and older, and 293,500 second doses. Reaching this 80% milestone is a significant achievement for the community, and Canberrans should be very proud how we have all worked together and given our city the best opportunity to manage the expected increase in cases as the nation starts to reopen. We're now well on our way to having close to 99% of our eligible population fully vaccinated by the end of November. There are around 68,500 second doses still to go, though, and that will be the priority over the next several weeks. As a result of reaching this vaccination milestone, the ACT government is in a position to bring forward the recommencement of in-person retail shopping. That will start from 11:59 p.m. this Thursday evening, the 21st. It will take place under a 1 person per 4 square metre operating requirement. ACT businesses providing essential retail under click and collect or click and deliver models can also reopen their doors from 11:59 p.m. on Thursday, again at 1 person per 4 square metres. The high vaccination rates and the stable average case numbers over the last few weeks will allow the government to further ease restrictions from 11:59 p.m. on Thursday the 28th of October. This includes the relaxation of capacity limits across a number of different industries, including hospitality and major events. Food courts in the Territory will also reopen under a 1 person per 4 square metre operating model. From Friday 29 October, face masks will no longer be mandatory outdoors. They will, however, still be required indoors. Subject to the public health risk at the time, the ACT will remove the COVID-affected area declaration right across New South Wales from Monday the 1st of November. This means that ACT residents will not have to quarantine when they return to the Territory from any part of New South Wales, including the Greater Sydney area. This aligns with the decision of the New South Wales Government to allow travel from Greater Sydney into regional areas of New South Wales from that same date, Monday 1 November. Now, as previously outlined, and similar to the arrangements the ACT had in place throughout most of this year, we will move to an individual local government area assessment of public health risk from 1 November onwards. This will allow the Chief Health Officer to declare high-risk local government areas as COVID-affected areas with relevant stay-at-home or quarantine requirements should a hotspot emerge. The ACT will also align our mandatory quarantine requirements for people arriving overseas, and we will align that with New South Wales, and that will come into effect on 1 November as well. The government is continuing to work on the implementation of what will be the baseline public health safety measures in late November, early December. And this will include the implementation of 1 person per 2 square metre density limits in hospitality settings. So our priority over the coming weeks is to continue to provide the second dose vaccinations to those 68,500, mostly younger Canberrans. And while we have reached 80% across the entire eligible population, the number of younger age cohorts that are yet to reach this milestone is an important factor in caution over the next few weeks. Ensuring these Canberrans are fully vaccinated before moving to baseline restrictions will be critical to the successful reopening of our economy and keeping our economy open beyond the reopening period. It's not just about one day or 1 week, it's about the longer term as well. And now that we have 99% plus first dose, and giving those people the time to get their second dose should give everyone much greater confidence about Christmas, the summer holidays and 2022. I'll now invite Dr. Coleman to provide her weekly update on epidemiology. Dr. Coleman will then take questions and following Dr. Coleman, I'll be available for questions. Thank you.